This is an area with possibly up to 3 million people affected. What we're hearing from our colleagues on the ground is descriptions of massive destructions, collapsed buildings, blocked roads, people who are wounded and injured looking for care, people spending the night in the street, and this in the poorest country in the Western Hemisphere. Unfortunately, we have to assume that it's very bad. The ICRC immediately made contact with its Red Cross partners, both on the ground in Haiti and in the region and here in Geneva, to coordinate our action. We've put at the disposal of the Red Cross relief effort relief materials in Haiti and the region for more than 10,000 families, and we're looking to airlift more, especially medical material and staff from Geneva as soon as possible.
Svært viktig at vi setter oss for det som mulig, og da...
It's the huge number of casualties that's been overwhelming. So it's been chaotic, and it's probably been worse than anything I've ever seen. What we see is limb injuries, fractures, that sort of stuff. But the rest, the chest injuries, the abdominal injuries, they die before we get them. So the gap there, first 48, 72 hours are really important. And we should try to cover that gap.
The immediate priorities are on life-saving emergency health care, treating many of the injuries that people have sustained as a result of the earthquake, and now dealing with some of the health-related problems due to the lack of water, sanitation, and good hygiene. The Red Cross Red Crescent movement is providing immediate assistance to the people affected by the disaster in the form of non-food relief items. These include things like blankets and kitchen sets, water purification materials, and immediate shelter materials. The Haitian National Red Cross Society is delivering essential first aid services, and the international response is supporting the National Society to set up first aid posts and to deliver much needed immediate assistance in the area of emergency health. An important part of our immediate response is the provision of life-saving support through mobile field hospitals and through what we call a rapid deployment hospital, which was mobilized in the immediate aftermath of the disaster, so that we can make sure that people who are in urgent need receive the necessary medical attention.
Donc après cette catastrophe, beaucoup de familles ont été séparées de leurs proches. Beaucoup de proches cherchent encore leur famille. Donc le CICR, conjointement avec la Croix-Rouge haïtienne, a mis en place un service pour permettre à ces familles-là de se retrouver. Donc ce service, il y a deux volets. Il y a la Croix-Rouge haïtienne où on peut se enregistrer et aussi l'Internet. Donc pour promouvoir ce service, on passe dans les quartiers avec un système avec des haut-parleurs.
Chercher famille, toujours enregistrer tête, toujours bien écrire nos familles avec nos parents.
Personne qui veut gérer les moules là-bas, appelle gratis pour lui. Quitte Miami, New York, Canada, venez devant la maintenant, grand barrière blanc, on vient avec gratis.
We have deployed 16 emergency response units. Those include 2 units for water production, water sanitation units that will each service 15,000 people every day with clean water, a mass sanitation unit which will try to rebuild the infrastructure of sanitation, 3 basic healthcare units which will provide outpatient services for people injured and sick, and especially in mobile clinic mode, reaching people who are harder to reach normally or who cannot access health facilities.
All emergency operations need to consider how they can respond to the immediate needs whilst keeping an eye for the longer-term reconstruction and recovery needs. If you like, a relief operation is a sprint and a recovery operation is a marathon. We need to start planning now for the reconstruction and rehabilitation that needs to commence as soon as people's lives are secured. This is the biggest ever emergency response unit deployment to a disaster in one country.